morning, everyone. It's my privilege and honor to be here to moderate this very important session on a very interesting topic, role of technology in bridging gaps and building community, which is something very crucial to the future of healthcare. My name is Rohit Singh. I'm Managing Director of Feedback Medical, a UK headquartered company, and we are into producing healthcare connectivity solutions. As we all know, today healthcare in India faces numerous challenges, whether it is about availability, accessibility or affordability, especially when you talk about the rural and the underserved communities and the areas. However, technology has shown quite an immense potential in terms of bridging a lot of these gaps and connecting communities to better health outcomes. So today we have 4 esteemed speakers who are going to talk about this important topic. They come with wealth of knowledge and experience to this discussion. So allow me to introduce them. Dr. Kuldeep Singh Sachdeva, President and Chief Medical Officer at Molbio Diagnostic. His company is pioneer in providing point-of-care micro-PCR diagnostic system that can enable sample-to-result molecular diagnostic capability in resource-limited settings. Mr. Vivek Srivastav, co-founder and CEO of Healthcare at Home in India. His company is a leading healthcare services at home and transient care provider company in India. They are present in 70 plus cities across India and have treated 4 million plus patients so far. Mr. Ankit Modi, founding member and chief product officer at Cure AI. His company is a leading artificial intelligence solution provider that enable automated interpretation of radiology images like X-rays, CTs and ultrasound scans and all. And then we have Professor Dr. Bipin Batra, Chairperson of Assessment Panel and Internal Quality Assurance at BAPIO Training Academy. BAPIO Training Academy has been at the forefront of medical education and professional development of our healthcare professionals. Over the years, BTA has grown into renowned institutions known for its structured residency program, innovative training matters and dedicated support for medical professionals. And we also have Sana Khan, Director Growth Twin Health with us. Welcome, ma'am. Thank you all for joining us today. Let's dive into our discussion. So let's kick things off by having each of yours opinion about what you think about from healthcare CSR projects context, the role of technology over the last 10 years, how this has been evolved, how you see that the landscape emerging out over the last 10 years. If I start with Dr. Kuldeep.
Thank you, Rohit. I think everybody in this audience probably feels now that technology has sort of been at the forefront of medical science in particular, but in general in all aspects of life. Even in medical science, I come from a company which has a diagnostic background, and based on my other previous experiences, we have seen more and more diagnostic modalities are getting better and better. We have now tests which are more sensitive, more specific, and if we say you are negative for a particular test, you can be pretty sure that you don't have that disease. Having said that, we are also seeing what is known as, especially our company's movement away from facility-based diagnosis. So we bring diagnosis closer to your home, your community, or to the most difficult places. And one of the innovation which our company did was miniaturization of polymerase chain reaction, as they call it technically PCR, and you now can do a PCR practically in a very small cartridge. It's more microfluidics, and you get up test results within an hour, and you don't need practically an operator or a technician to do those things. You just have to load up a sample within the machine. Having said that, my other colleague sitting here will also sort of let you know that even technology in besides diagnostics, in radiology, other areas, and even in intervention with the medical science has gained a great momentum. Most the solutions, the overall health outcomes are improving because of the technology. Even the surgery and other things are becoming easier, much easier to do because of the technology which we have today. I think stop here and give a chance to other speakers to delve on this.
Thank you, Dr. Kuldeep. I think what your company is doing, that's a fantastic job in terms of from a diagnostic standpoint, those were centered to a bigger infrastructure diagnostic center, and how these PCR diagnostic kit is connecting to the rural settings, and also great. So now I come to Mr. Vivek. Would you like to share your opening remarks on this?
Sure. Thank you. Thank you for inviting me over here. I think technology has transformed over the last 10-15 years since the time we started the company. And basically, what does our company do? It's into rehabilitation and recovery. We have centers which does rehabilitation of people in 30 to 45 days they spend in our centers. Then we do home health care, which is self-explanatory. And we have chronic disease management. Like you said, we are present now in 100 plus districts across the country. And when we think of impact creation in the society itself, and especially in healthcare, the problems which you talked about was access and affordability, right? And then standard outcomes, because you'll be doing the same thing in Delhi and you'll be doing the same thing in, let's say, Bihar, and there will be a difference in the outcomes itself. So even if you have access, you can afford it, still the outcomes would be different. All the three get significantly impacted by the use of technology. Because in healthcare, you have health and care. Care requires the human element, but the scale can come through technologies in the health side of things, like Sir talked about, especially in the diagnostic side, because there, if you invest in awareness, screening, etc., and using technology without dependence on human operators, that scale could be humongous, and then because we have limited number of people available for certain doctors or paramedics, etc., using technology, you can still dumb down the requirement of skilled people to deliver outcome, right? Something like that has happened in other industries like McDonald's, right? You wouldn't have needed a chef to make a burger, but now you can get it done with a 12th class pass, and you have all the processes and technologies involved in a different setting, giving a standard outcome at a cost which is reasonable, and it's accessible to around the globe actually. And the same thing you can do in healthcare also, where you're able to get, using technology, people assessed where you could not earlier, people diagnosed where you could not, people treated remotely which you could not earlier, and hence it's a huge thing in my view. And from an impact perspective, and from a perspective of people who are investing in CSR, using those opportunities, you can change lives of so many people who would probably not have got access or maybe affordability in this.
Thank you. Very important points. And in fact, the business where you operate, the healthcare at home, I also see that the way you talked about how technology can enable less skilled people to also deliver probably the higher skilled healthcare interventions, which in a way can also take care of the capacity crunch in the tertiary hospitals, in the acute care, and those areas, because this transient care is ultimately going to help, and that's where technology is playing a role. So thank you, Mr. Ankit. Mr. Vivek. So if I go to now Mr. Ankit, would you like to share your perspective?
Hello. Thank you, Rohit. Thank you, HEAL team, for the invitation. When we started the company in 2016, all of the founding members of the company, we had graduated in computer science and we had done our masters in artificial intelligence. And the germ of the idea was that, this is such a great technology and we cannot keep working on getting people to click more ads through AI, right? Like, I mean, it can do much more than that. And we thought that, I mean, if Facebook can recognize faces from your photos and suggest that, do you want to tag your friend? And this is like back in 2016. We thought, like, I mean, we can use the same technology to read X-rays and CT scans and tag certain kinds of diseases. When we started out on chest X-rays, especially on a perspective with tuberculosis. Our assumption back then was that the more developed countries will adopt AI faster, which is usually like the case with any new technology. For example, if you look at today at say something like an Oculus or a virtual reality tools, I mean, the developed countries are sort of adopting it first, and then it would percolate to the more developing countries of the world. But in healthcare, it was the exact opposite, and that was a great learning for us. That in the more developed countries, you can increase the efficiency of a doctor or a radiologist by 20-30%. But in the more developing countries, you can actually bring expertise where there is no expertise at all. For example, like US might have around 1 radiologist per 10,000 people. For India, that number is 100,000. And then there are entire African countries like Lesotho, where there is just 1 radiologist for the entire country. So there are just not enough radiologists to read these scans. And from a CSR perspective, what happened was that we saw a lot of NGOs, companies donating X-ray machines, tools to combat TB. But if you actually follow up that, like, these X-ray machines are taking X-rays, but there is no radiologist to read them, right? So that's when we started like sort of understanding how to also get funding towards AI for TB, so that there is actually radiology expertise, and we are not like just done with donating X-ray machines and be okay with it, because ultimately it has to be used then and there. And that was a great learning for us. We ultimately like sort of became a company who are like sort of using AI in now more than 100 countries. But it was all like sort of countries where you wouldn't imagine will be the first adopters of AI. And the learning was that, I mean, the necessity is actually a bigger pull than just like sort of having some cool technology. So yeah, that was some of the biggest learnings that we had in the last 8 years of scaling Cure.ai.
Thank you, Shrankit. Very important points. In fact, Cure.ai have been pioneer in this area in India and globally as well. And especially you talked about tuberculosis screening, and I think for the presumptive screening, how quickly this AI can interpret the X-rays, and at the very first stage, the initial diagnosis can be done. That is a game changer thing. Now I move to Professor Dr. Bipin Batra. If you can kindly share your opening remarks.
Yeah, thank you. In the last 10 years, we have seen the successive progression from technology-enabled projects to technology-driven projects. In fact, today, healthcare is the second largest consumer of CSR. And within healthcare, almost all the projects, they are primarily being led by technology. I'll give few examples before actually coming to what exactly we have done. If you see the world's largest retinopathy screening program, that is purely technology driven, implemented over the course of last 15 years from India. Some of the best tele-ICU and telemedicine projects have emerged out of India at a global scale. India's free diagnostics program, running as part of the National Health Mission, the radiology part of it is currently nearly 100% driven by technology. It is 100% driven by teleradiology. Very few centers where we have complete coverage of radiologists from end-to-end time. Moving on to education. In education, the model which we have set up, eminent consultants and clinicians working in NHS UK are training doctors in India. We have touched the lives of 259 doctors in the last 3.5 years when we started this project. We started, and our parent organization is a charitable organization. It is a British charity, and with a grant from them, we started this program, which is entirely technology-driven, hybrid program. Much of the clinical training takes place on ground, but supplemented by the well-established models of the
NHS and the NHS England. In the next few years, we are likely to see the emergence of CXOs or the chief technical officers being there driving the projects rather than stray combination of teams of few programmers and IT application specialists. And much of the attention already is going now for capacity building in all the workforce which is working on these projects for their technical empowerment.
Thank you. Very important and useful comments, Dr. Vipin. I'll come back to you again. Ms. Sana, from Twin Health perspective, how do you see this technology playing the role in the CSR side of the things? This Twin Health, as I understand, I think it's a very advanced and unique concept. So please.
I'm going to share more about Twin Health in just a bit, and I need everybody to listen to me with rapt attention because this is very important, and I'll make my comment very short and crisp.
Yeah, that I would request everyone because I have many questions and I'm also mindful of time that we need to cover up. So
Dr.
request.
Kuldeep, Vivek, Ankit and Dr. Batra, privileged to be a part of this panel with all of you. So when we talk about CSR, we're talking about huge numbers. In a country like India, we're talking about impacting millions of people at once, right? In a certain amount of time period to achieve results. And how do we do that? I think technology has a very, very crucial role to play. It is in fact the future of the country when it comes to sectors like education and healthcare, right? All of you have an example of how technology is helping us. If I'm sitting here, I want to order a locked door for my room, let's say. I'll just order it online, pay via UPI and ask a porter to deliver it to my place, right? Our house helps are using Paytm, UPI, all these transactions. So life has become very simple. A couple of years ago, this was not the case. So just look at the impact of technology and how we can now sitting here be a part of a live concert in America or any part of the world. So that kind of impact, I think, is what we need in a country like India. And when it comes to CSR and artificial intelligence technology, I'm going to list out some bullet points which I feel are the way forward. For instance, big data. We are using data in today's time, and data is so much more powerful. We can utilize that data and make an impact. With that, we can look at scalability in a country like India, right? We can scale any small project to a very big project, something which is unfathomable by a group of people, let's say a healthcare project. The moment technology comes into it, you can scale it. Then you can have measurable impacts. You can actually quantify the impacts that you are creating, right? That is possible only if you have data. Then you can bridge gaps, you can empower. People say when technology comes in, our jobs will be taken away. But I feel that the human touch, no technology can replace that. So in a sense, if we are creating a tool for radiology or other imaging and trying to provide solutions for that, in a way we are empowering our doctors, because we always complain there are not enough doctors, there are not enough nurses in the hospitals for people. And then you can have personalized and very, very sort of precision treatment. That is the need of the hour. We won't waste time on figuring out what could be the solution, but using this data, we could have that solution ready-made. And Twin Health is into this. We basically use data, and we use that data to give our members a very, very personalized and precision treatment to cure, to get them, eliminate their medication for all chronic metabolic conditions. For instance, type 2 diabetes, obesity, fatty liver, PCOD, hypertension. Imagine if we can have these kind of solutions and scale this to a country like India. We're talking about curing millions of lives, helping people recover and live healthier lives.
Thank you, Ms. Anna. I'll certainly come back to you because you raised some of the very important points. Those were related to the data, and so I'll come back to you. But I think after hearing all the esteemed panelists, one common theme was certainly coming out that technology has started playing an important role in the healthcare space. And during this conversation, I'll try to get some more insights from the panelists around how we can link it up with the community initiative, CSR initiative, and how we can bring the partners together to leverage these technologies. So let me let me ask Dr. Kuldeep. Dr. Kuldeep, could you throw some light on different technology that mole biodiagnostic you are focusing upon in bridging gaps in diagnosis for patients and in communities? If you can, please.
Again, thank you, Rohit. So I'll divide. There are existing technologies and there are those in the pipeline. So I'll leave for the present what is in the pipeline. But existing, the most popular platform is called TrueNat. Again, it's a point of care diagnostic test. It can do about cartridge-based PSCR, turns around the test results in 40 minutes, and you can do tests for about 40 different heart diseases: TB, HIV, hepatitis, syphilis, other sexually transmitted infections, sickle cell disease, and so on and so forth. So 50 different type of diseases. The test result is turnaround time is 40 minutes, and it's fully automated. You don't need a sort of an operator, a qualified operator or technician to do that. That's one most popular platform which is being used. The other is called an ultra portable or a handheld X-ray. Again, it's a point of care. You can take it to any place. Again, very friendly to do that. It can do X-ray, which and on top of that, if you load an artificial intelligence software, which Cure was referring to, you also have the interpretation of those images. So that's another technology which is readily available. Third, a separate sickle cell device that's already available. And these are all point of care and address the question of accessibility. You can take them to any place. They are battery operated. You don't need an electricity to do that. So you are not dependent on electricity even in the most rural areas of any part of the world or most difficult terrains, and you can also mount them. We also then sort of put these things on either a SUV or an ambulance kind of a thing, so you can also take them anywhere you like and do it.
Thank you, Dr. Kuldeep. Unfortunately, I have been reminded again that we don't have much time. So what I'm going to do that I'll probably just quickly combine few of the questions, and then you, each of you can, in maybe a minute or two, just try to address that. But it's important just to key insights get to the audience. Mr. Vivek, if I come to your organization, so just quickly, if you can talk about how you are using technology for improving access and the affordability, and especially some work that you are doing into the CSR and the social sector. So that will be great.
Sure. So we have multiple projects which we do with the social sector or CSR, right? The first one is around screening and diagnostic, where we are doing programs which are like 50,000 people to 100,000 people being screened for liver diseases across the country using remote or using point of care devices, right? And that leads to a lot of early diagnosis, which leads to less mortality later. And similar things we are doing in liver, metabolic diseases, etc., and very, very large scale. And this is funded through CSR. The second type is when we have worked with PHCs, again sponsored by CSR, where we have done large scale adoption of PHCs and then doing doctor consults, because you don't have doctors there, consulting doctors, so telemedicine in that. And then we are using a lot of technology to enable people, like I said, people who will probably not be very well trained / educated, but using technology, telling them exactly what to do, much like what happens in a McDonald's, so that you're able to deliver service in off locations at a price which is much more reasonable, because you're not getting super specialist or super specialized infrastructure. All of that is available centrally, and hence you're able to deliver outcome in far-flung at lower cost. And then the fourth thing which we are doing is improving human capital, right? So just using technology which is generally, just video technology itself to train people from far-flung locations so that they become capable to become employed.
Thank you, thank you. So many important points, but unfortunately I will not be able to build upon on that due to paucity of time. Mr. Ankit, I'll just combine two things here. First, how you are using Cure AI solution to improve patient outcomes in the remote settings, and from a collaboration standpoint, how your organization is fostering collaboration between healthcare providers, government and NGOs, again from a CSR standpoint.
Yeah, so how we are bridging gaps there, I will give you an example of a project, right? So in Philippines, from their capital city Manila, there is a van with an X-ray machine that used to go to different villages from Monday to Friday, collect X-rays of probable patients of TB, and then it will come back to the city where radiologists will read those X-rays for 2 weeks, and then in the 4th week it will again go back to those cities with a TrueNAT test and the medicines for TB, and if they are confirmed then they will hand out those medicines. It was a 4-week cycle, and after 4 weeks a lot of those patients will not come back to the hospital because these are daily wage workers who will not want to lose one more day of their wages, and you lose a lot of TB patients because of that, which results in more propagation of TB among the community. With AI, what happened was we actually optimized our AI algorithms to fit into that X-ray van, where as soon as the X-ray is taken, within 30 seconds you get an AI diagnosis, and right then and there then you can do a TrueNAT test, and right after that you can hand over the medicines to the patient. So no patient is lost, so because of that technology we proved that a lot more TB patients can be identified, which in result means that a lot of propagation of TB can be controlled, and which also means that a lot of TrueNAT tests were being saved. So we did recently a study with ICMR where we proved that using chest X-ray AI is actually reducing the cost of identifying one TB patient by 10,000 rupees per TB patient. So that was something that we saw in the community. About the second question, building communities, right? So to run a screening program for TB, right? See how many technologies have to come together. There is AI for cough sounds, where multiple companies, where the patient has to just cough on their phone and then the AI will detect signs of TB. If there is something found out, then they will give a chest X-ray. The chest X-ray AI will do a screening over that, and then a mall bio kit would be present there where you will finally do the microbiological test, and all of this has to be funded by an NGO or CSR initiatives, and then governments are running these screening programs. So all of this is a lot of stakeholders are involved in running this program, and we have been trying to build a platform where all of this can come together, right? So on our platform we can host AI for not just chest X-rays, but any other AI company can come to the platform. We can host them and be that platform which provides those solutions. We build really detailed dashboards that governments can monitor and officials can monitor, which screening programs are working out well and not well. And then similarly, we collaborate with, I think there are a lot of sites where Cure and Molbio are present together, where these technologies are helping screen patients better and in a more efficient way.
Thank you, Mr. Ankit. Sorry I had to interrupt, but very important points and great to hear fantastic work that your organization is doing. Professor Dr. Bipin, I'll just combine two things quickly, and if you can just quickly comment on that. First, from a academic research standpoint, how do you see the healthcare innovations that can be adopted to the healthcare CSR project, just to ensure that their impact goes to the last mile, the community and all, and the sustainability aspect and how technology can enable the CSR projects to be more sustainable and scalable? Sorry, it was just few words on that.
See, the answer of both the queries lies in capacity building, and we have to address that from the very beginning. Today, a greater part of the grassroots healthcare delivery, whether it is CSR or public health network or even corporate public health and CSR projects, is being delivered by non-doctors, health workers, and possibly allied health workers. They need to be technology empowered with use of technology from the very beginning, with the use of computer-aided diagnostics, data surveillance, data analytics, I think it is important that we start building up knowledge about these tools, practical applications right in their curriculum, so that when they are hitting the market, they are working on the projects after attaining their requisite degrees, diplomas, they are ready for that environment, rather than spending another 2 or 3 years and more investment to make them technologically enabled.
Thank you, thank you. I think this was a very important point. When you do this from a training academic level itself, then it becomes easy to implement it as people go into the profession. So now, very quickly, I refer to the data point. So just very quickly, what's your comment on so many data is now floating around and the technology intervention, especially in the healthcare space, and when the CSR aspect comes into the picture, how you look into the data privacy, patients' data safety, and all. Your quick comments on that.
So there are laws that are very, very specific that one needs to follow, because data privacy is indeed a huge concern. And it's not just about the quantity of data. At the end of the day, it's about the integrity and the quality of the data as well. So if, say, I am tracking my steps in a day, or I'm tracking my heartbeat or my body fat percentage, I must be very mindful about the trackers that I'm using, right? They must be accurate, or as close to accurate as possible. So all these things I think we need to continuously work on. And in a country like India, there is huge potential, because if you talk about any AI player in the world right now, for them India is a gold mine, right? Because of the sheer numbers. And we have that advantage to ourselves. So we must take the lead, and we can be the world leaders if we take the right steps right now and set an example for the world to follow. So we can make a huge difference. And like I said earlier, in healthcare, education, all these social sectors, technology is the only way forward.
Thank you so much. Important, relevant comments for everyone. Just to add, even from our standpoint as well, we are deploying technology on community TB screening from a digital pathway standpoint. So I think the common thing from this panel is technology is going to be the key enabler, key driver in terms of scalability, transparency, and sustainability of the future CSR projects. What we all have to think it, how we can foster up good partnerships among each other, so that the wider stakeholders and the benefit could pass on to the community. So thank you very much for esteemed panelists and the wonderful audience. Thank you so much.